have hit some of the slides, so the syllables that you have might have a little bit more than what I'm going to present this morning. I just want to stay within the time allowed for my talk, and you have a few more slides in your handout. All right, these are my learning objectives for my talk. And the world of anticoagulation is getting more complicated, and it's a reality. A lot of our patients are on some form of anticoagulation. The indications for anticoagulants and antiplatelets are expanding. So, in the cardiovascular world, we're trying to make people bleed more. We are preventing ischemic and cardiovascular events, but there is a pay for that. And, I always get asked in my talk that I don't present a lot of guidelines. True, because probably about half of the cases that we encounter in our practice are not straightforward and not from the guidelines. And here's an example. I've got these are patients that come through my practice. So 54-year-old with a history of multiple DVTs on a new anticoagulant and aspirin, 72-year-old with a history of AFib and multiple strokes on one of the new anticoagulant, and a 68-year-old with a history of diabetes, stents, and multiple coronary arteries on aspirin ticagrelor. How do you manage these patients when they come to you for a surgical need? So there's always some complexity to these cases, and they're never straightforward. So let's take a case example. You have a 75-year-old woman with atrial fibrillation and a CHA2DS2-VASc score of 3, so hypertension, chronic heart failure, that require total knee surgery. And she's on rivaroxaban. She's been doing well on it, had a cardioversion 6 months ago, and has normal renal and liver function. So I made it, a simpler, relatively simpler question. And we get asked this question a lot. The orthopedic surgeon would pick up the phone and say, okay, what do I do with the Xarelto? How many days I have to stop it? Do they need to be bridged with Lovenox before their surgery? It's just a common question. Let me throw 4 scenarios for you. A, you stop the Xarelto or the rivaroxaban for 3 days without bridging with a parenteral agent or low molecular weight heparin. You stop it for 3 days and use bridging with another agent. Stop it for 5 days, prior with a bridge, and you stop it for 5 days with no bridge. And oftentimes I get, especially sometimes, for dental procedures. I had a patient the other day, the dentist stopped their Xarelto 10 days before the